I'm Peggy Boyles, Director of Development for Arkansas Support Network, and I will be your moderator. I've been with the organization for coming up on 3 years in March. So we're all aware that the entire world has been impacted by the COVID-19 virus. And the burning question has been, when will we get a vaccine? Well, guess what? We have a vaccine. And so you would think people would be standing in line to take it, right? Unfortunately, that's not the case. Right now, a lot of people are taking a wait and see approach. They want to wait and see how it impacts someone else. And so the burning question right now is, do I take it or do I not? So we've assembled this panel because you guys are trusted and respected employees of Arkansas Support Network. You've all taken the vaccine. And so we want to get an idea of what you experienced when you took the vaccine. So what we're going to do right now, if you will, is I'll introduce you. And if you could tell me what your role is at ASN and how long you've been with the organization. And so let's start with Dr. Saird Evans.
Hi, I am currently the CEO of Arkansas Support Network. I have worked at Arkansas Support Network. March will be my 21st anniversary. I started out as a direct support professional. I love most being a direct support professional. And even in my role as CEO today, there are a couple of families that I continue to serve in a direct support role with.
Thank you, Saird. Let's go with James Wilkes.
Hey, my name is James Wilkes. I am the Director of Quality and Programming. I've been with ASN for about 25 years, so I've been here quite a while and started out as a DSP and continue to do so. And my main role is making sure that people get the quality services that they deserve.
Thank you, James. Let's go to Michelle Chavez.
Hi, my name is Michelle Chavez. I am a division specialist, division support specialist. I've been with ASN for 7 years.
Thank you, Michelle. Next, we'll go to Terrence Spencer Sr.
Sorry about that. My name is Terrence Spencer. I've been with ASN for 10 years, and I'm a direct support professional.
Great. Thank you, Terrence. Now let's go to Katie Mosby.
Hi, I'm Katie Mosby. I'm a care and training parent for Arkansas Support Network, as well as a DSP, and I've been working for ASN for about 8 years.
Great, thank you all. So let's just dive right into the questions. So a lot of people who are reluctant to take the vaccine think that people who have taken it just don't have a care in the world. It's just no big deal. And we all know that that's not true because we all have concerns about the vaccine. So if you will, share with us what your first thoughts were and any reasons that you have considered and you may have considered to not take the vaccination. So let's start with Michelle.
Well, at first I was not, convinced to take it, but I realized that talking to my parents and my parents being, real sick and ill, and I decided for me to be the first one to give the first step for them to realize that they need to take it and realize that they have to take that for them not to not to get sick or stuff like that.
Great, thank you. How about you, Terrence?
Yes, ma'am. I was apprehensive about the shot at first, but my wife, she's an RN also, and she actually she'll be getting her second this week. Yes, she was kind of the guinea pig. I'm not gonna be anything but honest. I was definitely apprehensive about the shot, but just with her medical knowledge and talking to several people, I was convinced that it was something that I need. And ultimately for me and my family has been touched by COVID personally in several cases. And it was simply, do I want the symptoms of COVID, or am I, going to take the shot and give it a shot on that? Because the people that I know that had COVID, they actually passed. So it was serious for me.
Wow, thank you. How about you, James?
Well, I mean, I have an underlying condition. First, I'm an old guy, but I have diabetes, and I was apprehensive. I wanted to, and one of my main reasons was I didn't want to put anything in my body that I thought that may harm my body. I've been doing well so far, but we haven't encountered a virus like this before. And so once this happened, I weighed my options and I weighed the consequences. And I thought that at this time, the best thing for me to do was call my doctor, asking would I have a reaction or would any medication I'm taking affect. He said no. He said, quite frankly, James, you need to take the vaccine. And at that time, I talked to my wife and family, and I thought it was in the best interest of my family and my health to take the vaccine.
Great, thank you. Okay, how about you, Saird?
So for me, one of my biggest concerns wasn't necessarily if I will take the vaccine, but when. My expectation, I've worked really, really hard over the last month and a half to influence the state system and to make sure that the people we support and the people who work for us were getting recognized in priority status. And I had no intention of being vaccinated at this point. My kind of timeline in my head was that 3 or 4 months from now, when there's greater access and it's opened up to more people, that I would go get vaccinated at that point. And I really saw my role as today as holding the door open for all of the folks that work for ASN and that receive services from ASN, and that was my plan. And I tend to be the type of person that once I have a plan, that it's I'm pretty stubborn, and so it wasn't. I got a phone call late in the evening from our operations team the night before the vaccine clinic was scheduled to be, I guess Monday afternoon. I got that phone call, or evening. It was about 7 o'clock in the evening, and they'd been working they'd worked 2 12-hour days straight, calling people saying, "Great news! ASN has the availability for vaccines, and we have this many number, and you can go get it on Tuesday from 9 to 12." And they had almost twice as many people tell them no as told them yes. And so I hadn't even thought about it. I had not even considered it, because in my mind, because I'm the CEO and not someone who's working full time as a DSP, I hadn't considered it as being something that was going to come up for me for months and months to come. And so my first response was no. It's not time for me. We need, I'll get it after everyone else gets it. And they kind of said, well, here's the reality. We have access to this specific number of doses tomorrow, and you know as much as anybody, if we don't use them tomorrow, they're going to go back or go bad, or even worst case scenario, they're going to waste. And you do serve as a DSP on a regular basis, and you meet the criteria, and there's potential that it would benefit other people to have somebody else be willing to be the guinea pig and go first. But my concerns, and I've had conversations with other people in administrative roles, or other people that maybe work as an advocate but not a DSP, that are declining because they're saying, well, other people have more of a risk and they need to go first. And so that was very much one of my biggest concerns and hesitations, and the reason why I said no a couple of times when I was called and told, hey, it's time for you to go take it.
Great, thank you. Okay, Katie, why don't you talk to us a bit about any reasons that you may have considered not taking the vaccination, and any reluctance that you may have thought about?
Of course, I had concerns about taking the vaccination. I think, like many people, because it is so new, I was concerned about long-term effects, what may or may not happen 10 or 20 years from now. I very quickly realized that I can't base today's decision over on what may or may not happen 10 or 20 years from now when I know that thousands of people are dying every single day because of this virus. I could never live with myself knowing that I was responsible for someone I know and love, or even a stranger getting sick or, God forbid, even dying because I didn't do my part. So taking the decision, making the decision on whether I would get the vaccine or not was a very easy decision for me. The professionals say that majority of the population have to get this vaccine for us to be able to go back to normal. More than anything, I want to go back to normal. You know, I want to hug my grandma again. I want to have Christmas with my family and not having to worry about someone getting sick or dying because I didn't do my part. So the decision to get the vaccine was a very easy one for me.
Great. So you all obviously overcame any reluctance you may have had to getting the vaccination. So tell us about how you reached that decision. Were there any resources that were helpful for you? Did you read an article? Did you speak with anyone? Who influenced you? And here's a question. Are there specific people in your life that you thought about when making this decision? And I know Katie already sort of answered that question, but that was a nice segue into this one. So let's start with Michelle.
Honestly, my husband went through last month. I saw the way his uncle passed away. They had a video camera there, and I saw how he suffered. And it was really difficult. And I look back and I was like, no, I have to put it on. I have to show them that it's something can help us. You know, that was really hard on us. It hit us really hard. Sorry, guys.
You're okay. Do you have any more to add or?
No, I cannot even speak right now.
Okay, thank you. Thank you so much for that. We appreciate it. Okay, James, how about you?
I'll be honest. It's me. I think I hadn't had a flu shot in 25 years. I hadn't taken a flu shot because I felt like every year that went by, I didn't catch the flu. I figured there wasn't a reason to take it, and hadn't had the flu, thank goodness. But when people are dying, and when people are dying, you think of your family. My mom has underlying conditions, so we look for other people for support, and we want to take care of each other. And the way you take care of each other is by helping each other. And once I got to that point and figured out that I needed to do what I thought was right for me to protect my family and my mom, and so this whole ordeal for me was, uh, hey, look, it's difficult not to take a flu shot for 25 years and then take a vaccine that you're not sure about. But once again, I weighed the consequences. Taking the vaccine was a big thing for me and a big step, and I'm glad I did. And to be honest, when the lady said she's going to give me the shot, I was talking to her and I said, "When are you going to give me the shot?" She says, "I'm done." So I haven't had any ill effects from the vaccine. I got a sore arm, and that's gone by now. So we're just going to continue to move on.
Great. Okay, how about you, Terrence?
Yeah, I think we all thought of somebody special. It was my mother who has underlying conditions, and this is the first Christmas and Thanksgiving in 20 years that I hadn't seen my mom. And that's one of the big things that's really bothered me. And also, as I was stating, family friends right across the street from my mother, a mother died, a daughter died, and a brother died within a span of 30 days from COVID. I mean, our childhood friends that we grew up with, their mother died, the sister died, and all under 50 years old. Not something you would see or think that would be affected by COVID. And it just first of all, I went there and I was like, hey, do I want to go through the horror that they went through, or maybe the side effects of what this shot may have. So to me, it was a A or B choice, and A was the choice. And like James said, the only thing I had, my arm was sore a day or so, and and that's worked out now. So
Great, thank you. Okay, Sarah, how about you?
I am a nerd in all senses of the word, and I've watched closely, the data and the research and the process on this stuff, really with a strong motivation of the fact that, at ASN, when the rest of the world shut and closed and started shifting their focus to try to figure out, how do we work from home, how do we learn from home, how do we do all those things, we went to work. we support, we provide direct supports to over 400 people across the state. We provide incidental and situational supports to close to 3,000 individuals and families across the state. We have 800 employees, and at no point in time, we've had people quarantined, and we've had direct support professionals work in doubles and triples and probably quadruples. We've had people quarantining in with sick folks that have just packed a bag and moved in with COVID positive folks. And so for me, I have been obsessed is not a strong enough word with following any signs of hope through all of this, right? Any opportunity that could slow this down and make this a situation that becomes safer for the people we support and the people we employ, and nothing out there is putting a dent in this. But the vaccine data and research is so encouraging and so hopeful, and I know that for people that are afraid, for people that know the history of this country and the terrible ways in which we have violated and harmed marginalized people through our medical research over the years, it doesn't matter what the data says. And I respect every bit of that. I think that those are legitimate concerns, and I support people who have them. And one of the approaches that we're trying to take as an organization is not to respond to people who say, I'm not going to get vaccinated because I know that the US government injected syphilis in Black people as a part of the Tuskegee experiments. I'm not going to say that's not a good reason. That's a damn good reason. And I respect that reason. What we're trying to say in response to that is, okay, that's valid and legitimate. What would help, right? What can we do to help work you through the concerns that you have that are extremely valid, to get to a place where this is something that you would consider? And so for people that data does matter, there are some data points around this vaccine that are pretty miraculous. So for me, there are some data points that are really telling. Like James, I never got a flu shot. Last year was the first year that I had ever gotten a flu shot. And the only reason I got the flu shot is that I started volunteering for a local hospice organization, and it was required. I couldn't go visit hospice patients as a volunteer if I didn't have a flu shot. So I got a flu shot. Because for me, things like that, I'm less concerned about what the consequences are for me personally, and more concerned about, the greater good and the people around me. So I got a flu shot. But one of the reasons why flu shots were never really of interest to me is most of the time the flu shot has about a 50% effective rate, right? So it's still half and half. You get a flu shot, half and half. Is it going to protect me or is it not? And that's, those are betting odds and whatever. this vaccine is showing success rates of protection at between 93 and 97%. Compared to the flu vaccine, which a lot of people, trust every year and just kind of do it as a part of their regular routine. I mean, that's almost double an effective rate. And just really looking at the data, looking at the science, really convinced me that, when it comes up, I'm not going to have any concerns about that. What I needed to process and what I needed to work through and address was the timing of it, right? Like, it's okay. It's my turn now, and it's okay for me to go take that. And what really influenced that for me is similar to Michelle's experience, and what Michelle talked about is just, this is an opportunity for me to be a model, and to be an example, and to go first. And if there are horrible things that happen, right, if my skin falls off, or if I grow a tail, or whatever that looks like, if horrible things happen, I'll take that hit for the team, and then we can figure out how to fix it from there. But the opportunity to really be able to at least provide some assurance to people, to say, hey, I know somebody who got vaccinated and it was fine for them, was a big influencer for me to make the decision and go get vaccinated on Tuesday of this week.
Well, thank you, Sarah, and I will keep hope alive for no tail and you keeping your skin. My goodness.
So far, so good.
Katie, I know
Yes.
you have answered part of that question. Did you have anything else that you wanted to add to that?
Well, I mean, like everybody, I think that we all know somebody with underlying conditions. I can maybe get corona, and I may be asymptomatic. I may never even know that I have it. My husband has 2 of the top 3 underlying conditions. He may not fare so good with it. I'm not willing to basically play Russian roulette with anybody's life, whether I know them or whether I don't. I don't want to wait until it hits so close to home that I lose someone because of it, because I didn't do my part. So it was easy to know that I needed to do my part.
Great, thank you. Okay, so Terrence had to leave and take care of some business, some ASN business, but we're going to continue with everyone else who we have on the call. And so what we want to do now is talk about your experience taking the vaccine. All of you work out of our Northwest Arkansas office, and the first vaccine clinic was in one of our statewide offices. So you actually had to drive about an hour to go and get the vaccination. So in addition to the inconvenience that you may have had trying to figure out how to travel last minute, please tell us what the process was like. Was there paperwork? Was there a line? Did you have a long wait time? And I don't know of anyone who likes needles. So tell us about the shot. And let's go with Katie.
It was honestly probably the easiest shot I've ever had to get. The 15 minutes that I had to wait after in the parking lot took longer than the process itself. I had to fill out short little form, little bit of information, walked in, got the shot, barely even felt the shot. I feel the flu shot. This shot didn't even feel. Was in and out in 5 minutes, and thankfully I had no side effects. So it was a very easy thing to do for me.
Great. How about you, James?
Well, I agree with Katie, chime in with Katie. We had everyone come through the front door. We did our screen checks with temperature checks and all that. People filled out a form. They were in a room. I think like Katie said, less than 5 minutes, the shot was done. And like 15 minutes took longer than the shot in the process. So social distancing was there. We had people flowing in one door and going out the back door to prevent any cross, back and forth with each other. And quite frankly, it went real smooth.
Great. How about you, Sarah?
Yeah, my experience was very similar. We had great teamwork from lots of different folks across the ASN team. We had managers and a member of our nursing staff that when cars would pull up in the parking lot, that they would bring the consent form to people's cars and allow people to fill those out in their cars, maintaining that social distance and that safety level, but also having a nurse out there in the parking lot was good if there were people that had questions or, were still kind of working through some of those nerves. Somebody that knew a little bit of something about vaccines and injections and all of that being available was really, really helpful, I think. And I witnessed a couple of people who were able to kind of take advantage of that. Having a person with those credentials and RN that was in the parking lot was helpful, I think. Really proud of our folks and working together and kind of setting up this process that really kept people socially distanced and safe. And I am extremely grateful for the pharmacy partners that we have. They were awesome. They had a system in place. They made it, seamless, and they were running people in and out in a timely fashion. And that's, for us, that's just one pharmacy partner. We're currently working with about 6 or 7 pharmacy partners across the state in planning follow-up clinics. And I can't say enough about the pharmacy industry as a whole. Like, this has been such a major endeavor and a last minute kind of thing. And just the way that our pharmacy partners have dived in, and they're moving these vaccines, and they're putting opportunities out there for people. The shot itself was the easiest shot that I can remember getting, and I hate needles. Nobody likes needles, but I actually talked to several employees who said that they joked with the pharmacist. I think James mentioned this too for him, that they joked with the pharmacist as they, swabbed up and got ready. Like, I hope that's it. And the pharmacist was like, yeah, you're done. Get out of my chair. It really was just an easy process, which it needed to be, given all the kind of anxiety and nerves around it. It was so nice to get there and just be able to walk through this really orderly fashion. And I think that speaks to a lot of people's fears and anxieties too, as well. I think if we got there and people didn't know what they were doing and it was confusing and there was a lot of disorganization, I think there are a lot of people that had worked up the nerve to go that would have gotten in their car and left, right? It was such a high anxiety kind of thing that I don't think people could have tolerated a lot of disorganization in that process. And fortunately, that's not what they faced. It was really smooth. It was really organized. And we got a shot. And I think most of us will tell you it was a painless process, which is not usually the case. So that was not only my experience, but it's what I observed from a lot of folks that also got vaccines that day.
Thank you. So Michelle, can I guess that you had a similar experience to those?
It was the same. It was really fast and smooth, and it was organized, and it was pretty easy.
Right. So it's been 3 full days since you all had the vaccine and you are all vaccinated. So tell us how you, and some of you have referenced how the shot was. So tell us how you feel. Do you have any symptoms? Did you have any soreness? And tell us how you feel emotionally about making that decision. And so let's start with Michelle.
Well, that night I started having headaches, and I was really feeling really tired. But I guess it was was part of it. And then the next day I still was feeling tired. Other than that, I didn't have headache or nothing. The third day I was feeling great, like nothing happened. And I had a lot of phone calls of my family saying how it did. I was like, yeah, good. So I guess they're taking it too. So I'm like so excited, and I was like, yeah, it was great.
That's great. How about you, Katie?
I actually got lucky. I didn't have any side effects at all. My arm was sore at the injection spot for a couple of days, just like after any shot I get. That's over now. Emotionally, I feel like there's been a huge weight lifted because I feel like this is the beginning to the end of something that has been really hard for everybody, you know. So I feel less stress, and I am very happy that I got the vaccine.
Great. Okay, James, how about you?
Well, I was a little nervous, because I told you I really don't like putting things in my body, so I was really nervous. And every hour that went by that nothing happened, I was happy. But I was relieved I had it. Like I said, I only really had a little soreness in my arm, and that was it. So that like I said, knock on wood, I haven't had any symptoms, and like I said, other than a sore arm.
Great. Sared, any symptoms?
Yeah, I haven't experienced any symptoms. My arm was sore at the injection site, which is I've heard a lot of people say that, and I would say that it's more sore than what I've experienced with shots in the past. And that lasted, the first 2 days. And today I haven't noticed it at all. And so it went away pretty quickly. I would say emotionally, I have the experiences of feeling really relieved, and thinking about, I typically wash my hands so many times throughout the day that by the end of the day they're like raw and burning, and put hand sanitizer on them and they burn. And every time that sensation comes, since I've gotten the vaccine, for the first time, I think about, this may not be how I have to live every day of my life. Although I don't see a future where I'm not washing my hands pretty regularly. But I've also felt really guilty, and talked to a lot of people about that, because again, for me, I went into this week with the expectation that we were going to celebrate the wins of vaccinating ASN employees and the people that we support, and never had let the thought enter my mind that I would be receiving one of the first doses. And so the responsibility that I feel for the people in this organization causes me to still feel guilty about it. I have had lots of people who have reached out and been really appreciative of me kind of being vocal and honest about that and sharing that, and more people than I deserve reminding me about how important it is, for the people that work for us and for the people we support, that I am vaccinated, and just the benefits of, to Katie's point, she talked a lot about, the worst thing for me has always been the thought that I would be asymptomatic and get some of those folks sick. And so, it's that weird place of being really, really relieved, and really grateful, and also feeling really guilty about it, because there are still so many people that work for us that have not yet been vaccinated. And, in Arkansas, the folks we support don't fall in the 1A priority category. So we're still waiting on the state to move on to 1B priority so that we can start vaccinating the people we support. So I'll feel even better about the process once we can move on and ensure that every single person that works for us and that receives services from us that wants to has been vaccinated.
Great, thank you. So I have one more question for all of you. What advice would you give to someone who may be scared or on the fence about getting the vaccination? What would you say to them? Let's start with James.
I would tell them, every COVID case is different, which means every person is different. And you just have to take a look at yourself and ask the people around you any questions that you have, or ask any doctors or nurses that you know. But every case is different, and everyone's going to make their own decision, probably based on a different reason.
Great, thank you. Katie, what advice would you give?
Do your research. Don't listen to Bobby down the street or Mary at the store. Do your research. Um, Educate yourself about it. Weigh the positives and the negatives. Weigh the benefits out. And if you don't do it for you, do it for the people you love. Do it for your neighbor. Do it for the strange. Um, I just say educate yourself about it, if anything.
Great, thank you. Michelle, do you have any advice you would give?
Well, like guys, the first thing is talk to the PCP. Is the only thing that I can say is just like, do not pay attention what others says. The first thing is to go and talk to your doctor. That's the first step that I think that's going to be best.
Great, thank you. How about you, Sarah? What advice would you give?
I would just encourage people that are having some real reluctance or have just said, I'm not going to get vaccinated, to really ask themselves and consider, why I've arrived at this decision, and what would help, right? I think that for all of us, we're different. We all have a different priority structure. There are the things that motivate us are different. And so, I've heard from a lot of people that are really motivated to get vaccinated because of loved ones that they're concerned about who have high risk factors. But then, I've heard from a lot of people that have just dismissed this vaccine because they don't take other voluntary vaccines, right? Like James and I both fall in that category where we could have been people that said, well, we don't get flu shots. And so, I think it's such a frightening experience, and it is so new, and there's so much that's unknown about it, that it's really important for people that are having major hesitations, that are declining, to ask themselves, why do I feel this way? Why am I making this decision? And seek out that information or that input that's going to help speak to those fears and concerns. I don't encourage anybody to get vaccinated who is adamant that they don't want to get vaccinated. What I do encourage people to do is to really explore what they're hung up on, what is really interfering with their ability to confidently go and do that, and seek out support in addressing some of those factors. And if at the end of it you still say, I don't, it's not right for me, I don't want to get vaccinated, you can at least have the assurance that I did my work, right? I did my due diligence. I explored what I needed to explore. I sought out the information and the conversations and the resources, and I haven't changed my mind. Okay, but that's where you'll be. But you can have the assurance that you did everything possible to make sure that it was the most informed decision that you could possibly make. To everyone's point who has spoken, and especially to Michelle's and what she shared with us, there's a whole lot riding on this, and we have lost so many people, and so many people have suffered, and there's been so much fear and pain that has come with the coronavirus. I think it's important for all of us to embrace the responsibility of figuring out if there is something that I can do to positively impact this and help us move forward, then I'm going to show up and try to do that to the best of my ability. So that would be my recommendation.
Perfect. Well, Sarah, do you have any final words that you would like to give us?
I just am extremely and eternally grateful for the folks that we reached out to starting last Thursday, and we harassed all throughout the day on Monday to say, hey, here's an opportunity tomorrow on, within a 24-hour notice to get a vaccine. It's brand new. It's not really been tested a whole lot. As far as I know, we were the first folks in our field that had access to that, and so many questions, so many unknowns, and folks that were willing to go through that process and work through the concerns that they had, and be brave enough to show up. And I live every day of my life grateful for the folks at Arkansas Support Network, and that's no different. But for that group of people, I think we had just a little over 70 folks that were brave enough and willing enough to step out there and be first. And I already know that has impacted other people. We've already had individuals that work for us that declined the first question, who've reached back out now that some folks have gone through and said, I've changed my mind. I want to sign up. I want to be on the list. I'm grateful for the dedication that the DSPs and employees at ASN have to this work every day, and I, particularly since March of last year, and the way they show up and the way they stay committed. It doesn't make a whole lot of sense, and there's every reason in the world why people would say, there's a safer way to go through this pandemic. And that's just not been the case. Our workforce has been here from day one. And those folks that once again showed up in a way that the rest of the world didn't have to, or hasn't, or won't have to, I'm eternally grateful for that. And I'm excited about, for the first time in 10 months, really feeling hopeful. And we're here today to really share those experiences, not only with everyone at Arkansas Support Network, but with folks across the state and across the country. And if there are ways that we can support people as they work through these decisions, I'm happy to support those efforts. And so we just encourage people, feel free, reach out to us, reach out to me. We'll help in whatever way we can to share our experiences. But this is important work for all of us to do, and I'm proud to work with a group of people that are leading that way.
That's great. Well, thank you all so much for taking the time to educate us and to tell us about your experiences, because I do believe that what you all have said today is going to help a lot of people in their journey in deciding what they're going to do as it relates to this vaccine. So thank you all so much for your time, and thank you for your commitment to ASN.
Thank you.
Thank you.
Thanks, everyone.